It's my pleasure to share with you what has happened to me and my society after we have been supported through the Nutrition Third Well, after getting the grant from Nutrition Third Well, IFS, and others. I'll talk on these lines. So the PhD study concept and the acceptance, the PhD research sponsorship, findings of the PhD study, and also the way the international community received and responded to my findings, and also the benefits that I got and my institutions got from these initiatives, and then talk about the impact of the NTM support at the regional and international levels, and try to build the cases to why Nutrition Third Well should actually continue to support and support more, and give you the conclusions of what I have experienced. So, ladies and gentlemen, this is what we are discussing, and using an example of stunting, there is this slide which is often used by many people who are working in the sector of nutrition, health, and agriculture, trying to explain factors that determine stunting. You all know about genetics, you know about nutritional factors, the mechanisms used in infections, and the way it affects or it contributes to stunting, the maternal factor. But my researches have been on dietary and environmental toxins, mycotoxins in particular, the way they also contribute or are thought to be associated to stunting. So that was actually the basis of my research. And through the thinking at that time, we observed that growth retardation begins during the time we introduce complementary foods. And that in my country, Tanzania, these are actually maize-based. And we know there are a lot of factors that are associated with maize-based complementary food. And there had been a study which was led by Dr. Mamiro, who is also present in the room, which actually could not find any improvement in growth of children when they were fed with a processed complementary food. And then we postulated at that time, using some references on studies that were done in Ghana by the group of Professor Wild and Professor Gongong, who had actually found an association between aflatoxins and stunting. And because fumonisin, another mycotoxin, is also a very important contaminant in maize, and maize being a complementary food in Tanzania, we thought we should explore whether actually there is also an association between fumonisins and impaired growth in my country. And to be able to do that, I needed a PhD sponsorship, and I got a sandwich program support from the BTC at that time. So you have funding to stay in Belgium for about 4 months in a year. It's a 4 years program, so the rate of time you stay at home. Ghent University liked the idea, so I got supervisors from there. Professor Kostrin is here, and Professor Bruno, I think he's not in the room, he's unable to attend. So we worked together with the BTC scholarship, and I did not have research money. And so here is how we ended up getting support to do that kind of research. So we actually approached IFS, in accordance with their limitations, and being the first time I'm applying, so I got about 12,000 USD to look at the contamination in the food, and perform some sort of an exposure assessment, see the magnitude of the problem. But Nutrition Third Well said this was the riskiest part of the study, actually, trying to explore the association between fumonisin exposure and stunting. And many donors actually would hesitate to fund in there. And luckily, Nutrition Third Well thought they can fund that. So I got money from the two institutions. And thanks to these two institutions, then I was able to do the studies. And these are the main findings from the study. So we actually confirmed that Tanzanian maize is actually highly contaminated with fumonisins and aflatoxins. And we observed that in infants, actually, exposure is quite high, higher than the tolerable intakes that are recommended by WHO in many of the children or the subjects, and we were able to then indicate that through dietary food intake exposure assessments that actual children who exceeded the WHO limit, they were actually shorter than those who were less exposed. And therefore, we found an association. And with the exposure assessment, we were able to say that actually if we reduce intake in maize in particular, up to 20 grams per child per day, which is unrealistic in our communities, or limit the contamination of fumonisin in the food that is consumed by the children, you are actually able to protect them against exceeding that WTO tolerable limit. But these are all challenges, and we made some recommendations. Therefore, we said with this information at that time, you need to integrate already measures in the guidelines for nutrition, measures that will prevent contamination and exposure of toxins in the food. But also, and this is very important actually, because we need to have a critical mass of people who understand the problem, so that we can be able to now to optimize the utilization of the capacity, including some going to politics possibly. And but we thought that we had done our exposure assessment using a limited sample size and using food dietary intakes, but there are better methods which include the use of biomarker. So we said we needed a bigger study to actually confirm what I had found, whether really exposure to fumonisin would impact on child growth. And so these were recommendations, and also taking measures, like having pre-harvest and post-harvest measures that will prevent exposure in children. So these were recommendations from the PhD study. And then immediately after there were responses from international community. Yes, we were able to publish. That's good because they see you. But also we achieved our objective of trying to see if there is a problem and documenting the problem, providing the evidence. So this is what happened. Immediately I went to Tanzania. I was approached by Professor Chris Walt. He just ended his term with International Institutes for Research in Cancer, a WHO agency, but at that time he had not gone there. He approached me, he said, so Martin, with your group, you found an association between fumonisin and child growth, and they had found in Ghana, in Togo and Benin, an association between aflatoxins and child growth, poor child growth, and so they said they could get money for me to collaborate with them and try to see what is really the problem. Is it aflatoxins or fumonisin? So we did this study with the University of Leeds. Dr. Gongong got in. But in addition to that, we also started writing to VLIRUOS. And in 2 years after that, we actually got our own initiatives where we were given more support with this much for 4 years, trying to develop effective strategies, pre-harvest and post-harvest measures that can actually prevent contamination of aflatoxins and fumonisin in the maize-based complementary food. So these were immediate supports, but IFOS, knowing that they had actually supported that. And one of our recommendations was trying to see if there are more than aflatoxins and fumonisin mycotoxins in the complementary food. So IFOS gave us more money. We actually looked at the issue of multiple mycotoxins exposure or intake in the complementary food. And these are some of the main findings. Again, after this second round, we confirmed that exposure to fumonisin or its co-exposure with the aflatoxins is actually contributing to poor child growth in Tanzania. So important here is that there was a very significant association between intake of fumonisin and slightly less association when it comes to aflatoxins and poor growth. But also we actually now confirmed that these children were exposed to multiple mycotoxins, deoxynivalenol, fumonisin, and others. They were there. It's not only fumonisin and aflatoxins. And then we had this was defended this year at Ghent University, where we saw multiple of interventions that we can do pre-harvest and also post-harvest. But there are still questions to be answered. We do not know actually the mechanism that is involved in child stunting when it's associated to mycotoxins. We are trying to answer this question through a Bill and Melinda Gates funding in Tanzania presently, not actively involved, but I'm advising them on this. They're trying to start this in Dodoma, trying to see what mechanisms are involved. But also we want to see the cost effectiveness or the efficacy of some of these findings we have found in the field, but also importantly, advocacy and sensitization, and involving a multi-sectoral, approaches, just like we have been discussing after Richmond's presentation. So now, just to share some of the, the benefits, I talked about the benefits to my institution, benefits to me as an individual, and I know you would always start by knowing that I was awarded the PhD. That's what we actually try to get as an incentive when you are doing, but I was telling Natalie in the morning that immediately after PhD and 2 to 3 years later, my wife observed that I was still as concentrating the research just like I'm going for another PhD, and then she asked, I thought you finished your PhD. No, the problem had not been, answered, and possibly will not have these solutions in the next 10 years, or there will be many more years for us to. So I got promoted. I'm today a professor, but I served at administrative position also to very high levels at the university, and now I'm serving at international organization level, though still going back to the university with my PhD students, understanding that actually I do not think I've already achieved my dream of trying to address this problem as far as it relates to health and nutrition. But there are also some other examples, maybe in this room it could be. In 2010, I was appointed as a permanent corresponding member for the Royal Academy of Overseas Sciences. So I'm corresponding with the academy, and I'm happy that I'm actually communicating everything that is coming from here to the community in sub-Saharan Africa, so that we can do that. But yeah, I was talking about when I came to these same premises to actually defend my PhD work in terms for a prize after I had been nominated by the Belgian Minister for Development Cooperation to be awarded because of the really good relevance of my PhD work to development, and this was an honor. I was also, these are some other, very critical publications or outputs coming from my work thereafter. This is a very recent one. I think the African Union is still contemplating as to whether to publish this report or not. It's a book-like report which I finalized this year. It has very shocking results regarding contamination in the complementary food, and where we were talking about replacing maize with sorghum, for example. Sorghum has the highest contamination presently if we compare with maize. Those are the results we have. Difficult to share. We need some approvals from the government, but there is this kind of I authored this myself, and I honestly feel that it's difficult to share, but the problem is still there. Another piece of work, which is very important, mycotoxin control in low and middle income countries. So we met in WHO, International Agency for Research on Cancer. With all the scientists, we kind of documented the magnitude of the problem in Africa and other low-income countries, and also, put their recommendations of mitigation measures. Measures to mitigate that. This is available online. You can read these documents. So these are the PhDs I've had. There are a lot of masters also from Nelson Mandela. But also I acted for about 2 years supporting a woman in agriculture researcher, mentoring her, and I'm happy that she ultimately became an excellent researcher and was also employed as a lecturer at Nelson Mandela. So TFDA laboratory capacity was very much, improved in terms of the mycotoxin analytical capacity and risk assessment. And we also I led actually some government officials to write a proposal, and we got 20 million USD from World Bank to tackle the problem of aflatoxins in Tanzania. It's just started. Unfortunately, once you get the money, it becomes political, so we are not very much involved in its implementation. But also we had a Center of Excellence at Mandela, which also managed to do. So I've been in these committees, but also I worked tirelessly and got some standards set by WHO for this. And I worked for Parker, if you have heard of it. And presently, this is my work. I'm trying to actually help the EAC use science in development of standards for the region, and also try to reduce implementation gaps in terms of the systems that they should use to implement those systems. So why NTM should do more and more, there are issues. First, we need to always derive needs from the society. We bring those needs to the laboratory, and they create a critical mass of scientists who will be able now to address all the issues and translate research to workable policies. This was said a lot by Richard, and integrate nutrition in all walks of life. So conclusion, ladies and gentlemen, you can see the conclusion here. I could not have been this without the NTM and the other donors' support, and Tanzania as well, and I believe Africa has benefited a lot from this. My acknowledgement to all these institutions who supported all the works I've been doing, all of them mentioned, and the partners I've had in there. Thank you very much, colleagues.
I had a question about the study. So you found with the increased levels of the toxins that there was decreased growth, but I presume these are in the same regions and they're having the same complementary foods. So have you deduced a reason why some kids might have increased levels versus other kids if they're having the same diets, I presume, in these regions?
Just a follow-up question, because we know the value of cereals, especially maize, in some African countries. Is there a possibility of looking at genetic modification to reduce the risk of aflatoxins and the formalisins in the maize?
Thanks, Natalie, for the challenge. There are a number of issues that we still have to address, as I've said. And actually, I know that the one regarding mechanism is we have some money from Bill and Melinda Gates Foundation, and we're in the second year of implementation. So at least there's something happening in that area. With regard to the other areas, no, I haven't had, we haven't actually tried to look for sources, and I'm very thankful for that. We will actually aggressively move the agenda on. We finished, supporting the team. We did the mini trial with Bill and Melinda, just fight for the second phase, which we just started. And certainly we will be coming to donors, including IFS, and having more scientists coming to you. I was actually talking to Carl yesterday about somebody who want to develop, to build a mycotoxin capacity at Department of Technology, Sokoine University of Agriculture. Thank you very much. With regard to the reasons for the high exposure of toxins in some children and low exposure in the others, yes, clear indication is the type of food or the amount of contaminated food that you eat. So it's a function of the levels of toxins in the food and the amount of food, of the same food you eat. So children who are eating less of maize or less of contaminated cereals, they have low exposure. And we did and confirmed that through biomarker studies with the University of Leeds. So it's about dietary diversification that can be helpful. Dietary diversification can be helpful. Because even though a commodity or a type of food is contaminated, if you take very little of it, it doesn't really affect you. There was a question about whether genetic modification can actually help. That is one of the solutions. But it's not in the package of the program that is currently going to be implemented in Tanzania. But actually, we are advocating for MALT approaches. And because it will be difficult to advocate for one type of interventions. But GMO, genetically modified maize, for example, would actually have low levels of contamination.
Thank you. Recently, I've heard in Ghana that there is a collaboration that is going to happen between the Mexican government and Ghana to use nixtamalization for addressing aflatoxins. My question has to do with the cultural acceptance of food that has gone through nixtamalization. I don't know what your thoughts on that, because I am not aware that there are foods in African settings that use that process for processing maize, for example?
Yes, thanks, Richmond. We haven't done a lot of studies on nixtamalization, but actually it helps in terms of the studies we have seen. And it is the question of funding. I remember when we were with Partnership for Aflatoxin Control in Africa last year, we developed a project on nixtamalization submitted to IDRC. It was not funded. In some communities, like in Tanzania, there are communities that use not the same, but actually the materials going into there, they are acceptable. So if you tell them what is going to nixtamalization, that's not difficult in your communities at all. So you started with introducing it and tell them what is actually there. And in the end, it is one of the solutions.